Good morning, everyone. I'm Dr. Lee from the First Affiliate Hospital of Fujian Medical University. Today we are going to talk about the neurologic image. It will be divided into 5 parts, including rupture aneurysms, hydrocephalus, cerebral atrophy, brain tumors, and multiple sclerosis. First, let's talk about rupture aneurysms. The normal artery wall is composed of 3 parts, including internal, medial, and outer members. The congenital weakening in the artery wall will cause aneurysm. The most frequent central neural system aneurysm is Berry aneurysm. Here is the figure showing the portal views of the brains and major arteries of the brains. The predilection site of aneurysms is vessel branching in the circles of Venus. The structure of circle of Venus includes left and right internal carotid arteries, left and right anterior cerebral arteries, left and right posterior cerebral arteries, left and right posterior communicating arteries, basal arteries, and anterior communicating arteries. The reasons for growth of aneurysms include hypertension and aging. Large aneurysm bleed most frequently. The imaging examinations aims to discover and for the neurosurgeons to treat the aneurysms before it undergoing the bleeding. A critical size for rupture could be 10 mm in diameter. Once the onset of rupture of the aneurysms, the blood usually enters the subarachnoid space and is about 80%. Rupture aneurysms is the most common non-traumatic cases of a subarachnoid hemorrhage. Today, the most aneurysms are detected by CT angiography and MR angiography. CT angiography is a kind of non-invasive examination using a CT scanner and injection of contrast media and to do the post-processing technique to show the 3 dimensions of the picture of the aneurysms. Similar to the CT angiography, MR angiography is also a kind of non-invasive examination for a doctor to detect the aneurysms, but it can be done without any contrast media. And sometimes we performed the MR angiography with the intravenous injections of MR contrast media to allow the highlights of the blood vessels being studied. Recognizing a subarachnoid hemorrhage from a rupture aneurysms is very important. On CT scanning, blood is hypertensive and may be found within the sacral and basal systems. Plaque can be hypertensive and wide with regularly margin. The greatest concentrations of the blood indicate the most likely site of the rupture of aneurysms. It means when we find there's a high density in a specific place, it's quite important to show that it may be the possible site of the rupture aneurysms. And some other cause of the intracerebral hemorrhage could be trauma, arteriovenous malformations, tumors, and so on. Now let's show you some cases. This is a 84-year-old female complaint about sudden unconsciousness for 4 hours. And there is aneurysms on the initial segment of the right medial cerebral artery. We can also find the aneurysms on the 3 dimensions reconstructions. On the CT scan, we find a lot of the subarachnoid hemorrhage on the suprastellar systems and the lateral sulcus, cerebral flux, and lateral ventricles and sulcus showing the high densities. And this is a typical signs for the subarachnoid hemorrhage and intraventricular hemorrhage. Here is another case of a 68-year-old man complaining about a headache for 12 hours. On the CT angiography, we find the anterior communicating arteries that showing a Berry aneurysms. Also, we can find on the 3-dimensional reconstructions. On CT scanning, we also find a lot of high-density hemorrhage on the basal systems, flux, and sulcus. Here is a MR angiography without a contrast injections, and we find aneurysms on the terminal segment of the left internal carotid arteries. It also showing a high signals on T1 weight images and very low signals on T2 weight images. And we can also find the huge aneurysms on the 3 dimensions reconstructions. Okay, let's go to the second part of the hydrocephalus. Hydrocephalus is defined as expansions of the ventricular systems on the basis of an increase in the volumes of cerebral spinal fluid contained within. There are several factors causing hydrocephalus, including under-absorption of the cerebral spinal fluid and restrictions of the outflow of the cerebral spinal fluid from the ventricles, and overproducing of the cerebral spinal fluid. The main features to show the ventricles are dilated compared to sulcus. The temporal hormones are particularly sensitive to the increase of cerebral spinal fluid pressures, especially when we find the temporal hormones are greater than 2 mm in size. They are divided into 2 types, obstructive and non-obstructive hydrocephalus. Communicating hydrocephalus is caused by the inhibition of the resorption of the cerebral spinal fluid, and most frequent at the levels of arachnoid villi. resorption through the glenoid villus can become restricted by such things such as subglenoid hemorrhage or meningitis. The radiology findings for the communicating hydrocephalus could be the dilatations of the fourth ventricles. And for treatment of the communicating hydrocephalus, usually to do the ventricular suction. Here is the cases of the communicating hydrocephalus in the 9-year-old boy. We can see all the ventricles are dilated, especially for the temporal columns are greater than 2 mm in size. This is another case in the 81-year-old man, and the ventricular systems are dilated huge, especially for the temporal holes are greater than 2 cm. The diagnosis of the communicating hydrocephalus, we need to rule out the obstructive factors. It means that we cannot find any obstructive lesions within the brain. And to the lung communicating hydrocephalus, usually caused by tumors, cysts, or other physical obstructive lesions. Also, in congenital hydrocephalus is often produced by the blockage between the third and fourth ventricles at levels of the aqueduct surface. When the obstruction is caused by a tumor, it usually needs to treat by the surgery to remove the obstruction lesion. This case is caused by a hematoma on the cerebral balance, and the fourth ventricle was compressed to cause the hydrocephalus. And this case is caused by the tubercular meningitis and causing the expansions of the ventricles, especially for the ventricles is dilated hugely. This case is caused by the medulloblastoma. It causes the lung communicating hydrocephalus. We can find a huge mass in the fourth ventricles. Non-obstructive hydrocephalus from the overproductions of the cerebral spinal fluid is rare, and it can occur with the plexus papilloma. We find a mass in the posterior ventricles, and with the huge dilatations of the ventricles. This is a lung communicating hydrocephalus. This is another case with the choroid plexus papillomas. We can find the suprasentinel ventricles is dilated. Another special type of hydrocephalus is normal pressure hydrocephalus. This is a form of communicating hydrocephalus. The treatment, the only way is the ventricular peritoneal shut. Radiology findings is similar to other forms of the communicating hydrocephalus. We can find the enlarged ventricles, particularly to the temporal holes, with the normal and flattened circles. Now let's talk about the cerebral atrophies. Disorders associated with gross cerebral atrophies are also associated with the dementia, Alzheimer's disease. Atrophy implies a loss of both gray and white matter. The major findings in patients with Alzheimer's disease is diffuse cortical atrophies, especially in the temporal lobe. For the cases of cerebral atrophies, we can find the normal dynamic of cerebral spinal fluid productions and absorptions, and the proportion enlargement of the both ventricles and the circles. Here is a CT scan in the old man. We find both gray and white matter is lost. Both the ventricles and circuits are enlarged. This is an 87-year-old man with the proportional enlargement of the both ventricles and circuit. Okay, let's have a break.